let's see, I'm going to record this. We'll be sharing the PowerPoint with everybody today. We'll also be sharing the chat that goes on with everybody today. Let's see, okay, so first, this is the housekeeping that we always have at the beginning of these sessions, is that I see everybody is using chat to the fullest, to the way that we like to use it. Think of chat as a business card exchange, a conversation with your fellow attendees here. So topics that we bring up, you know, you can chat amongst yourselves and share your thoughts. But I recommend that if you don't mind people contacting you and you want to network, share your name, organization, and contact info in chat. Now, very important, and is that you need to use the drop-down menu that says all panelists and attendees. So if I see that your messages look like you're trying to get something out to everybody, and you're not using that drop-down, I'll try to send you a note. So just double check that when you're using chat. Second, today especially is going to be super interactive. Just the format is designed intentionally that way. And so if you want to make a comment on any of the topics that we're talking about, you've got two ways you can do that. You can raise your hand and we'll put your voice on live, or you can use Q&A. And I really do as much as I can to get everybody on and address every question that's relevant during our sessions. All right, let's see how you guys, so you want to see how everybody's feeling today? There is so 62% of us are feeling really good today because it's Friday, and I can commiserate with the 8% that says don't ask me this till we're through all this COVID-19 stuff, but I don't know if we're ever going to be through it. So anyways, I'm glad to see that the majority of us are feeling really good. It's a weekend, although the weekend doesn't really feel much different than the weekday, but we're psyched to have this series on Friday because it gives us things to think about. Think about the future of aging and what may be down the road. Okay, let me see. I think I've covered all the housekeeping, so let's get started. This is going to be a really cool. No. I want to run through one more thing, and then we'll bring Bart on. We'll bring Bart on and start the discussion. So many of you saw in some of my emails a week or so ago, we did a survey. Now that we've got a month of these discussion webinars under our belt, I really wanted to kind of find out what works, what doesn't work, and what we can do differently. And so I'm not sure if you guys can see the results here on this, but the bottom line is, you know, as far as pre-event communication goes, the sign-up process, the content of the programs, the ability to ask questions, and the follow-up after the program, these sessions get pretty high marks. We're going to keep fine-tuning it, and I want you to give me feedback, but for the most part, that works. The one challenge and one area that we can improve is in the networking that we provide at these meetings. And bear in mind, we got a wide variety of people that are commenting on this, and so a lot of times the negative comments, and this is a tip for you marketers, are people are too aggressive in the chat. They're posting their contact info 5 times. You know, that can be a negative. We got a wide cross section of folks when it comes to networking. For those who hate the chat and it drives them crazy, if you click on your chat button again, it will disappear, and it doesn't need to be a distraction. For those of you who love the networking, have at it, but just bear in mind that you don't necessarily need to repost your contact info more than once, because all of us can download this chat and I send the chat to you. So after these meetings, you can go and cut and paste and contact the people that you want to connect with. The second thing, and the second thing that I wanted to share with you, I'm sharing this because this will be helpful to all of you out there that are doing webinars, is getting a read on what time and day seems to be most convenient. And as you can see, Tuesdays seems to be the preferred time or preferred day. And the time of meetings is generally lunch or morning, seems to be the professional community that attends these events, their preferences. And lastly, our survey tool enables us to use the Net Promoter Score. And the Net Promoter Score, if you're not familiar with it, it goes from negative 100 to positive 100. In terms of, is your service, is what you're offering something that people will share with other individuals? And so these online discussions get a Net Promoter Score of 71, and on a 200-point scale, that's pretty good. In fact, anything that's 50 or above says that the majority of people like what you're doing and they're sharing it with others. So, that's the business end. Let's get this discussion going. Let me take a quick glance at chat. I'm gonna just call out a few folks. Sarah Watson, your message only went to all panelists. Elizabeth Brazil, your message went only to all panelists. So repost your messages. Everybody look and make sure that when you send something in there that you've used the drop-down menu that says all panelists and attendees. Hopefully someday Zoom will fix this. Okay. I am going to ask our guest, Bart Astor, to unmute here. Bart, say a few words.
I am here.
Excellent. Awesome. Great seeing you, Bart. Even though you're down in Florida, you feel like you're right next to us here. So
I
those
don't
of you,
feel like you at all.
So just kind of a brief intro to this topic and Bart in general is that I was on LinkedIn or Facebook a few weeks ago, and I noticed one of my contacts had shared this article, "What Will Life Be Like After COVID-19?" And I started reading the comments, and there was a bunch of, great discussion going on underneath there. So I clicked on the article and read it, and then I realized Bart Astor wrote this. And I've known Bart for years, and I was really intrigued by the topic and the questions that he was pondering at the end of this article. But just a little bit of background, and I'm going to let Bart kind of share this with you. But like I said, I've known Bart for years. I met him when he published The Baby Boomer's Guide to Caring for Aging Parents many years ago. And he was when I saw that there was a local author that wrote such a relevant book, I called him up, introduced myself, and I booked him for one of our live events, which I hope someday we'll do another live event. But because Bart lived nearby, I picked him up in my car and we drove to the venue together and we started chatting. And one of the intriguing things that I kind of like to share is that Bart has been the author of many books, which you can see them all at bartastor.com, but he's written quite a few cliff notes and sort of the quote unquote dummies style guides. And if any of you have ever heard me give presentations on people on how to choose a senior living community, you'll know that what I try to do is I reflect the discussion towards, you're not looking for an old folks home, you're looking for a college. Pretend you're a kid looking for the next college that you're going to. It's a much more positive way of looking at a challenging transition. And where I got that idea was in that car ride with Bart, because his background is as an author has been in college admissions. And so I didn't know if you knew that, Bart, but I thought I'd share that. And
Thank you, Steve. That was great because you told me that the other day, and it makes so much sense.
yeah,
It was a wonderful comparison. Yeah, I
yeah.
love that.
So Bart, give us just a little bit of your. I know I sort of gave a little bit of background, but tell us kind of what you're doing now. And you're obviously writing for Forbes, and your most recent book was for AARP, The Roadmap for the Rest of Your Life. And what inspired you to write this article? What will life be like for seniors after COVID-19?
It's such an amazing thing because thank you, Stephen. Hello, everybody. It's really a pleasure to be with all of you. Part of what I want to do here today is getting to know more about you and what your answers are. I asked a lot of questions, so hopefully we can get to the answers. But just my background is I started out in student financial aid and started writing about it after I left campuses, and then I started writing. In fact, the first book I ever wrote was Financing Your Law School Education. Not that I know anything about law school, but it's one of those, you talk to the right people and you get to write books about it. And then funny thing that people think of you as the expert. When it came to the Baby Boomers Guide to Caring for Aging Parents, at the time, there was only one book out there, or maybe two. And it was amazing, and it was really hard to find them. There's nothing. This is the 90s. And yeah, I know that people have been thinking about it, but there really were no books. So when I said we were going through that, my wife and I were going through my mother-in-law, she went through all of the stages. It was quite amazing. And we screwed up every time she hit a new stage. We didn't know what to do, and we made lots of mistakes. So I decided to investigate this and learn more, and that out came the Boomer's Guide to Aging Parents. And it was really interesting because you learn so much when you write the book, and then you start meeting people like Steve. In fact, so meeting Steve and several other people, some of you who are on this call, I met that way. Time passed, and I started doing some other books and some other work. And then I somehow got hooked into AARP and wrote back. So we decided that I started thinking, I follow my own life. And I said, what's next for me? And I don't know. And when I don't know, then I start having to ask, what is next? And I start talking to people and thinking about it. So out of that came Roadmap for the Rest of Your Life. Actually, with Roadmap, that was from something that Gail Sheehy had said when she was talking to an AARP group. She referred to her husband, Clay, who at the time was pretty ill and not quite in hospice, but things were bad, and everyone knew. And the doctor came out to their house and said, asked Clay, what are your goals for at this point in your life? And I thought to myself, well, I don't have an answer for me. I mean, his answer was probably something like, well, I want to be able to attend my daughter's wedding or see my grandchild or something. And he was close to the end of his life. But I'm not close to the end of my life, and I still don't have an idea. I didn't have a goal. I had no idea what my goals were. So out of that came a roadmap. And so the transition to today is I started thinking, well, what is life going to be like for me? I'm a senior. I'm 72 years old, and I don't know what's ahead. I know what I can plan on, and my wife and I do make these plans about what we're going to do, but I don't know what's going to happen post-COVID. We know that when the shoe bomber, back then, 25 years ago, whenever it was, as a result of that one incident, we all take our shoes off to get on a plane. What kind of sea change are we going to have after this pandemic is in some way modified, or whether the vaccines or something, after we're really basically through it and life is sort of back to what we knew being somewhat normal, but what is the new normal? So out of that came just brainstorming what kind of, all these questions about what's next, how is it going to affect us? And that's what I want to get from you is, what do you all think is going to be the big sea changes?
Great. This is awesome. And this is what intrigued me about this article. And so just so you guys know, if you glanced at the article or if you read it, at the end, there's some questions, and we've sort of pulled out 6 of them, and we're gonna walk through these, okay? But I want to add a sort of a new dimension. Is so when I saw this article, some of you guys may not realize, I teach aging studies at UMBC, and I have an undergraduate class and that I teach. And you're probably saying to yourself, number one, if you didn't know there was a School of Aging Studies, you're sort of like, wow, I didn't know that. And what kind of kids sign up for classes in aging studies? Well, I'll let you know, my undergrad class, 100% of the class has no interest in aging when they enroll in this class. In general, they're majors from all other parts of the school, but they need to take a writing intensive class to graduate. And so, you know, I think they all heard I was an easy A or what have you. So they sign up for my class. And, but to me, it's a very fulfilling and exciting journey with them, sharing with them the world of aging as we all know it on this call. And so when the article came out, I used the questions at the end of the article for discussion with these 18 to 24-year-olds that are in my class. And so you're going to see a bunch of slides like this as we go through today with some of these questions that we're going to ponder. And I just pulled some of the students' responses, because the beauty of a young student responding to some of these aging-related topics is that they're a blank slate. Whereas many of us who are in the profession, we have biases that lean towards us staying employed and being relevant for the next 20 years, that lean towards what our own personal preferences are. And the students really kind of present an interesting concept. So this is going to be super interactive today, guys. And so Bart and I are going to start discussing these questions, but I'd love it if you all raise your hand or type into the Q&A your ideas and thoughts on these, and we'll try to go through as much as we possibly can and have an engaging dialogue. So the first question that we got on the screen is, will middle-aged people, essentially our kids, wonder and worry more about how the older generation is doing, and will that change their behavior? And I just want to highlight one of the students' comments, and that's all I'm going to do. You guys can hopefully read these now or later, but one of the students said, I would hope that with everything going on, it would make young people be more mindful of older people around, simply because they don't deserve to be simply a second thought or forgotten altogether. And Bart, I'm not sure your thoughts are on
Yeah,
this.
let me say a couple of things about that. Not much, because I want to hear other people, but older people become invisible at some point. And I'm not complaining about that. It's just that it's an observation. We are not taking into account when it comes to, think about the media, they target the 18 to 49. Well, 49 was a really long time ago. And yes, so I wondered about what will our kids, who are now in their 40s, what do they think about us? And do we become invisible? And I think right now I'm feeling probably yes, that we are. And because they have their lives, and I get that. So they're living their lives and they're all busy, and then their kids have soccer and gymnastics and whatever they're doing, and their lives, and we get that. But they don't call. I'm so reminded, my grandmother would say, you never call, and it's the same thing. We want to hear from them, we want to see them, And we're not together as much as when, 50 years ago. Now we're in much more mobile society. So I'm in Florida now, and I'm seasonal here. So we're back and forth to Virginia. So it's kind of an interesting thing, but we are invisible. And so I just wonder, when you're reading about all of the kids, all of the older people who are really suffering from COVID, well, I don't know, 40 or 50% of the deaths are people over 65. What is that going to do? Will it change that behavior? Will they even care? I mean, they care. I don't mean there's no caring and love, but will their behaviors change? And I don't know the answer.
Well, Scott Bach Hansen has added in Q&A, as someone in the world of selling long-term care insurance, I see members of the sandwich generation more open to options for insurance coverage because of what's happening to their parents. I have, in my 30-year career, I've seen this same phenomena that Scott is talking about, is that people that are more apt to buy long-term care insurance, to think about remodeling their home for aging in place, to consider a life plan community, are people that firsthand went through the experience of seeing what their parents went through. And I think addressing your comments there, Bart, for a lot of us, if we don't have a family member that is dealing with an elder care issue, it's pretty much invisible. But now this is front and center. It's in front of everyone, and I saw that firsthand with my college students that have made these comments here. Great. Okay, guys. All right. Well,
let me say one thing about that, however. So if you're selling long-term care insurance and you think, well, why would I buy long-term care insurance if my father or my grandfather doesn't have that much left? So it's probably not a good investment to do it. I don't know. I'm just posing that possibility that it's a harder sell.
Be careful there, Bart. I'm sure we've got a bunch of long-term care and financial guys.
It might be a harder sell because I'm thinking, they're going to get sick and die of COVID. So why would I invest all this money?
Absolutely. Yeah. Dorothy Keenan has a comment. Our children are very concerned about our safety, encouraging and helping us to stay home. I hear this from our friends too. Yeah, I mean, it's there's a lot of good things that are happening with COVID, and one is just awareness. And oftentimes, elders may feel like they're not being thought of by their loved ones, or their family is so busy running around, like you said, to soccer games and what have you, that they're not necessarily engaging, even though they're in the back of their mind. The COVID-19 has really brought that to many of our attention. Okay, well, thanks. Keep the comments flowing, and you can do it two ways, in Q&A, and you can do it by raising your hand, and we'll bring you on live. I just happened to glance at the comment or the chat, and Karen Wolf, this is not where to put your questions, but I want to say, Karen Wolfram says, I'm very concerned with the government running out of money since COVID. Medicare and Medicaid will be compromised. Rationing care, the government will be forced to print more money. That will fuel inflation and cause costs to skyrocket. That great question. And what's ironic is I'm glad you brought it up, because yesterday when Bart and I were talking, we kind of pulled down the one question that was related to policy. So that's a good one.
I think that's a good option, Steve. Karen, actually, thank you. That is a concern, and I think that's something that, because that has long-term effects, and a lot of these things that what I'm trying to glean from all of you is 3, 4, 5 years from now, what will have been the big sea change? I mean, government's running out of money or changing our, whether it's Social Security or whether it's our Medicare or any of those things, that's a pretty serious sea change and that we might experience post-COVID. Thank you for that observation. That's a really good one.
Yeah, there's some great, actually, it's awesome to have so many aging life care managers on this discussion. Holly Cameron as a comment, I feel it's been easier to approach the middle-aged children to interact with their quarantine senior. I'm not sure it would be easy to say, hey, let me help you, FaceTime with mom, or it would be great for the grandkids to send a picture. Personally, I've been more interactive with my own in-laws since COVID began. You know, again, I know I'm always inserting my editorial in here, but one thing that I've seen is that although people with loved ones in senior living communities, although they are not able to give them a hug and meet face to face, they're interacting much more thanks to technology than they would have pre-COVID. And so again, our interaction rate is higher, even though we're in this horrible time.
I wonder if that's going to be sustained. To those of you who said that, I wonder 5 years from now, are we still going to see the real increased interaction, whether it's through Zoom and maybe as a result they've learned more technology and so they're more comfortable with it, and so maybe there will be more. You know, when FaceTime first started, now everybody loves it, right? We get to see the grandkids.
Yeah.
Will that have sustained this interaction, or will we go back to being invisible?
Yeah, and my gut level feeling is COVID-19 has opened the door and taken a low adopter tech industry and brought us into the modern age. And I think now that the door is open, I think that we are going to see, especially if we have loved ones going into senior living communities, it's sort of like, well, now I can chat with mom 5 times a day if I want to. I can always see her if I want to. Whereas mom wasn't utilizing FaceTime or Zoom previously. Couple of in the Q&A, Laura Nichols says, I have seen some families come together connecting over technology like Zoom, MS Teams, house parties. We have more contact now than before. Great. Angela White says, what are your thoughts about adult daycare and senior centers? Do you think they will be needed in the next 5 years, or will assisted living and senior living communities be our new normal? Honestly, and Bart, I'm curious about your thoughts on this, but for me, one of the travesties is that we are not able to utilize adult daycare and senior centers right now because they are essential components to people who would prefer to age in place, but want that social interactiveness and love, and caregivers, giving caregivers respite. And it's horrible with adult daycare because so much of that population are the dementia, individuals with dementia who are being cared for at home. Bart, what are your thoughts on that?
We all know how important the interaction is and the social isolation. Now all the seniors, not all, but so many people who are living in facilities or even staying at home just don't have the same kind of interaction, obviously. And there's no hugging, there's no touching, there's not even closeness. We've all seen those heart-wrenching pictures of the daughter sitting outside the window while mom and she are both on their phones, and it's heart-wrenching. And mom is really, really hurting. And so we've seen those. So the interaction is so important. Are we going to be, we've seen, if so 5 years from now, will we have remembered how awful it felt to see those pictures of the isolation? I hope so. That'll be nice. I don't think it's going to be a sea change. I just, in my gut, I don't feel like, we'll come back to some kind of normal. And again, well, the kids have to go this and the kids have to that. So oh yeah, I forgot to call mom, so she'll call mom. And instead of calling, it'll be FaceTime. But yeah, and more seniors who are so much more familiar and comfortable with the technology because they've now used it and enough times that they can do that. So that's wonderful. That's a great sea change. So we
Yeah.
will be, we don't call anymore. We Zoom or we FaceTime. So that's a huge one. It's great. I do think though that it'll be, oh, I forgot to call mom. I'll call her. And maybe I'm wrong. I don't have the same optimism that maybe some others do.
Yeah. This is a good one. Donna Fuller from Ingleside says, in my 27 years in the industry, I've never seen a positive shift in the accurate portrayal of senior living by the media. There is an overemphasis of the negative, especially during these times. I'm witnessing firsthand the fear and misunderstanding the public has regarding the different sectors. There should be more of a focus on how our communities are doing an amazing job keeping those who live with us safe and engaged. The voice of those living in our community should be heard and dispel myths. We have many heartwarming stories. Now, I agree, okay, and you guys all know that I agree, okay, and that is, once we get back on track with Sourcebook, that is going to be one of my primary focuses, because what I've seen and what we've all witnessed here in this challenging time is a coming together of community. And what I mean by that, coming together of community of providers. Providers are supporting and interacting each other more than they ever were. But what we're also seeing is the families whose loved ones are in these senior living communities are rising to the occasion and coming together to create positive experience. The local restaurants that are around these communities are coming together. Nonprofits, people are making masks. The public is more engaged with senior living communities now than they've ever been. And I know that we can creatively figure out how to keep this going and continue to keep it more relevant. Great comment, Donna.
Hey, Steve, I want to add this. Thank you, Donna. Yeah. That is really good. A wonderful observation. And I know it came, I could hear it in the words, damn it, why don't they talk about the good stuff? And I get that, and you're right. They haven't talked about it. And we all know how good so many of them are. So we see the really lousy ones and we see the heart-wrenching stories. That is a wonderful, and maybe that is the kind of sea change. Well, see, if we keep presenting the negative and then we only see the negative, it may be harder for all of us to say, but there's so much positive there. Why don't you show that? Well, man bites dog. That's it. It's, it doesn't make headlines. There's no soundbite that says dog bites man.
Yeah.
But bites dog. So we only show bad, and that's going to put more pressure on all of you, I think, to make it clear how positive it is. I mean, a personal story. My father, he died at 96 years old, and the last couple of years of his life, he had in-home care. He and his wife both, and they shared an in-home person, and it was rough. I mean, they were starting to deteriorate, and things were getting bad. After my stepmother died, we asked my father many times, how comfortable are you being here? It's still at home. He said, yeah, I want to stay here. I want to stay here. And then after a short while, not too long after, a couple of months, he said, I think I'm ready. It's basically lonely here. The only person he gets to talk to is the caregiver. And so he said, okay, I'm ready. And we moved him to a facility. And he was, I guess, sort of happy there. At that point, he was getting worse and worse. He didn't live very much longer, just a couple of months longer. And but I saw how positive it was for him, even because he had other people around him. If you've seen it around the table at the lunch table, it's kind of funny. They're all talking at each other or stuff, but at least there's interaction as people. So I think I do think that it's a great observation to realize that they are much more positive than is being presented on screen.
Ardell Fleeson says, I'm on the Forbes article on their website. Bart's 10 questions are excellent. Is Bart planning 10 articles to answer them? How do we best avail ourselves of Bart and the industry answers? Bart, this is probably a good opportunity to tell the audience about the Next Avenue article that you're working on right now.
Well, one of the things I'm roping you all into is to give me the answers. I'm writing a 2-part series for Next Avenue, and it's essentially the answers to these questions. It's not going to be quite the same. It's like, number one is this, and here's the answer. But that's why I want to hear your observations. You are the experts. I am not. So this timing of this webinar was so perfect. So I'm going to have this 2-part series. The reason it's 2-part, it's too big to do the whole thing in 1,200 words. I mean, there's just not enough space to say anything meaningful. So we're going to divide it up into sort of the healthcare and the other side being more lifestyle. And so I really do want to hear your thoughts about this. And I please, when you have thoughts about, if you have your thoughts or your observations, your answers to these questions, I really want to hear from you. And Steve, you'll post the
yeah, I'm going to be sharing your contact info.
Yeah, and it's really important because this article, it's due soon. So please get back to me quickly.
Cool. Yeah,
and so my plan is, one last thing, Steve. My plan is so these kinds of things that I'm observing now, I would speak to you. We try to have a conversation quickly, and I would then your quote would be in there with your who you are, what you represent, who you represent. So please, I really love to get the answers and your thoughts. You are the experts, and that's the next phase.
No,
and then the other thing is, as Steve and I talked about it, I'd be more than happy if we can figure out ways to do this to present to whatever groups you have, local areas. I've done that in the past where I've, actually back in the day when you could travel and be with people. It was wonderful. I was out in Palo Alto, an old stomping ground for me, and I spoke to about maybe 50 or 100 people who were all essentially in the healthcare area, and I'd love to do that.
Right.
So we can talk.
No, I'll share your contact info, and
Please,
we can kind of get that going. Jennifer Brown, on the topic of negative versus positive PR, Jennifer Brown mentioned NPR has been running a pretty positive story about a Goodwin House resident. It's a periodic radio diary of the resident's experience living in Goodwin House during the pandemic. Man, what a great focus. I'm going to look that up, and I'll try to share that link with everybody. Jennifer, if you've got it, throw it into chat and people can check it out. Okay.
Yeah, actually, Next Avenue, by the way, of course, is part of NPR, part of PBS.
Oh, cool.
So their sister. Yeah, because Next Avenue is the PBS website for 50 plus. So they're, I don't know that exactly tied into NPR, but I don't know the relationship there. But I know on Next Avenue, they're putting out a lot of positive things as well.
Excellent. Yeah, it's a positive site. Okay, I put the next question up, and I also want to get to the questions that are coming in. Keep those flowing in, guys. And actually, what I think I'm going to do, let me just read through these questions that we're highlighting. I'm just going to read through all of them, and let's just make a big mixing bowl of these topics. Okay, so the next question is: will families think about adapting their houses and lifestyle to accommodate our living with them? Will the question after that is: will there be greater emphasis on seniors aging in place or sharing homes? The next question is: will there be more regulations placed on businesses to accommodate more seniors, or just the opposite? Will there be more restrictions on serving seniors who are at more risk? Will there be a surge of new services that will help seniors with their daily lives, such as greater emphasis on delivering food and goods? And I think next to last, will distance learning and continuing education, now forced for everyone, be used at a greater level by the older generation? Now they're more comfortable with technology. And then lastly, will there be more emphasis in the health community on geriatric medicine? And I want to read this one student comment because it almost brought tears to my eyes when I was reading it. And she said, as a person who aspires to be a doctor, I never thought about geriatric medicine as deep as when COVID-19 started to happen. And I know I'm not the only one. And, you know, again, the positive elements of what's going on, I always, whenever I meet a student who's going to med school or law school, I always say to them, it's like, have you thought about going into the segment of older adults? And they always look at me like a confused dog, kind of tilt their head. Why would I do that? And I think, again, with this front and center, and with the fact that you can make an impact in your job, a big impact in your job, I think we're going to begin to see more people flowing into this field. All these layoffs is also going to flow more talented people into our field. One of the big challenges is pay. You know, as providers, are we going to be able to pay to have the talent? Okay, so let me get back to these questions here. Sean Curry says, do you see a difference in the relationship with older parents, grandparents between rural and urban areas? Wow, really good question. I don't know if you've done any research on that, Bart.
No, that is, you know, it's interesting because the certainly the disease was really urban, right? All of the really all of the hotspots were urban, and now we're seeing more and more where it's going out to the breadbasket areas, and so we might be in the beginning where we see the urban versus rural. Right now, we know that there is just so little hospital care, so healthcare in some of these small towns, and that might change. We might see. I don't know. Would it be great if doctors say, you know, I'm going to go to, you know, Smallville, USA, and be the town doctor? You know, good question. Somebody have an answer? Somebody's done research back out of all of you?
Well,
it's a good question, though.
The other thing, the other, again, positive thing is that so many healthcare providers were unable, or just because of their client load or the way that their practice was made up, where clients had to come to their office, and that's the way it is, and it's not going to change. This has forced a lot of those providers to into telehealth. And again, assuming the compensation can be continued, I don't think that door is ever going to shut, and that will only make things better for people in rural environments.
They'll have access to telemedicine that no one would have. So that's that's going to be a really wonderful, positive aspect of going through COVID.
Let's see. Betty Shaughnessy says, it has been interesting to see siblings interacting as a group with their parents on Zoom. Yesterday, a family said they have seen each other more since COVID started than ever before because they would visit mom individually. The family members are so thankful to have the video calls with their loved ones, and we, the staff, appreciate the connection too. Great, again, a positive comment. And what I think, and I'm curious of your thoughts, Bart. I mean, I think that's a trend that there's no way that can stop. You know?
This, I think we've hit it. I think, Steve, you said it earlier. We opened the door to the technology, and we're now seeing how we can use it. So when the kids call, it's not one-on-one to Bart and Katie. It's that all of them are there, and we get to see them because we FaceTime, we Zoom. we're doing that with my doctor. It's all done telemedicine, or certainly email in general, any kind of technology. We don't have to be in the office anymore. I am a little concerned about something you said before, Steve, whether Medicare, about how the monetization of this, but that's a totally different interest. I mean,
Yeah.
you gotta not work. That would be an article in itself. That's 3 books.
Yeah.
But I think that the thing that what she said about sibling interaction, yeah, my brother and I have talked more. It's one of those things. We're all fine, but we talk more. Now, we don't have parents anymore, but maybe this is the kind of thing that we just get closer together again because we've all gone through the same really horrible time.
Yeah, especially the aging life care managers that are on the call are very used to these the dynamics of siblings concerned about mom and dad, and they can't agree. But part of coming to a resolution is communicating on a regular basis. And again, the Zoom calls where all the families together and you're interacting. Again, it could have the opposite effect, of course, in family dynamics, but I'm hoping that we see positive steps there.
Yeah, I want to say something about that, Steve, because when I first wrote the Boomer's Guide to Aging Parents, one of the things I observed was who is the primary caregiver. And of course, we all know it's the daughter who's the first. And then it's the daughter-in-law, even before the son. And then as somebody might do the long distance caregiving, and usually the son does the long, you all know that. You all know these things. And I'm wondering, is this kind of interaction now that because of the technology, that will change, that maybe son will be just as active as daughter in the future? Please, everybody, address that. Let me know what you think, or people that you've seen the change.
Yeah, can technology shift the caregiver's role and make it easier to sort of share and interact? Karen Wolfson, I just glanced in chat, not Q&A, made a really cool, really good comment here. We need more cleanliness. A bath shower 2 times a week is not enough. Amen. And we all know that. And the old model of nursing homes that promote that with the shower down the hall need to be, remodeled. But better food, less sugar and fats, more meaningful activities that encourage movement and proper breathing, help seniors' immune systems. Too many drugs, too much sedentary time. I'm completing a yoga teacher training, and this is not, Karen's comments are not necessarily exclusive to communities and facilities. I mean, a person that's isolated at home is facing the same exact issue if they need assistance for bathing and getting out and about. But that's a big concern. Let's see. Anonymous attendee, I see the short-term challenge for elder care to still be the shortage of labor for caregivers. I think that there are 2 levers to help address the supply problem. Increase the overall supply, immigration reform, work permits, and 2, increase wages that will attract more people to the industry, but will increase costs and make it harder for seniors to afford services. What do you see as potential solutions? Because now it's getting more difficult to maintain quality standards. Great comment there, Bart. Not sure if you can solve that world problem.
Wow, that's huge. Labor shortage. Of course, it had that. We all that's a really big one to address. And I also again wonder if we go back to being invisible, will that matter? Number 2, will technology make it so that one caregiver can handle 2 people? Well, not whatever, 2 can handle 3, whatever the number is, using the technology. I mean, I don't have to check in on mom physically. I can look at my Echo show that she also has, and we can visit each other that way, or we call. I have a camera in her house. I did it a year or two ago. Amazon sent me 2 Echo shows that have the video, and so they interact, and so I can look at mom. I can also look at the front door, that kind of thing. But so technology may make it, the labor shortage, we may not need as much, even though we know that this is so labor intensive. We're not talking about, rolling patients. We're not talking about the patients so much as people who just need looking in on and making sure that this higher level. We're not talking really high, real serious skill nursing. I think it might be the opposite effect. I don't know. Be interesting to hear what people think.
No, and also I think we're going to have people that weren't in caregiver roles traditionally that may be coming from the hospitality industry flowing into our field with challenges in other segments. Beverly Bugos says, what do you see for low-income seniors who are even more invisible than the general senior during COVID-19, but more so in general? It's especially difficult for those without families near. Yeah, the affordability, and I think we're all familiar with the elder orphan term. It's a horrible term, but it illustrates a big challenge, is people without money and without family connections. One thing, I'm going to put a commercial out on that family connection. This evening, you guys got it in my email, there's a screening of a film called Gen Silent. It's about LGBT elders. And one of the reasons that I like that film is throughout that film, it talks about individuals who are, because they came out of the closet, are not connected to their family, and how community rallied around them to provide support. It's one of the reasons why I like recommending that film, because I think for low income and people without families, that we can step up as a community and nonprofits and better provide care to those individuals. Martha Cooper says, how about the interim stage where we mourn together for all who have died during COVID-19? Wow, Martha, that's a powerful statement. Almost choked me up there. I totally agree, and that's very important. We've seen the numbers. It's comparable to 9/11 and battles that are being fought out there, and how we remember those that got caught, especially our clients, is very important.
I have to say though, Steve, sadly, yes, we have this really sad shared experience. And I don't have a great deal of positivity feeling that 5 years from now, we will remember that it was, oh yeah, we remember that. I don't know that that's going to change that much behavior. Currently, yes, short term, you're absolutely right. I think so. And generally, I'm a very positive person. It's just that, we forget. It's so easy to forget until we experience it ourselves. So when my mom was the one, or my uncle, or my husband, my wife, that's close to home. But then, and I'll be empathetic and sympathetic to somebody who's going through it 5 years from now. But yeah, I'm going to go back to living my life. Sorry to say.
Yeah. I'm going to keep on going here, guys. And I know that we've got a limit of, I know that we say that this is an hour meeting, but what I've been doing is extending it to an hour and a half. And I want to get through these questions and your comments. And then for those that want to hang around and network, we can do more of a traditional Zoom style networking. But let's try to make it through these comments and questions. And remember, Bart and I are just sharing our opinions here, but voicing these questions is powerful and therapeutic for all of us, okay? We're going to come up with the answers, guys. I'm confident. We had, close to 200 people on this call today, all right? How can we make senior living more affordable for mid or lower income seniors and their families? Many don't experience senior living until they need skilled or long-term care. This misrepresents the broad spectrum of housing, activities, and lifestyle options that are available. Sandra, this is a great comment and thought-provoking question. And I think some of the solutions that are out there now, home sharing is one solution that can help with affordability and sharing. And it doesn't need to be two elders or three elders that are sharing a home. It could be two elders and a young person that's providing support. That's one approach that enables us to get to scale. See, if I get financing and I go out and I can build an affordable senior housing community, I'm only taking care of, let's say, 60 residents. Whereas we need to come up with solutions like the villages and home sharing and creative ways where we are not bound by real estate and financing and things of that nature. And this is not to discourage affordable housing units. We certainly need them.
Now, let me comment one thing about that, Steve. It was interesting. Please, not the villages. Oh God, but I'm in Florida, so.
Oh no, we're talking about that. It's not the Florida villages. It's the aging in place villages. Yeah.
Okay. But no, but I think you bring the point is home sharing, and there are lots of options, and we know the options. Maybe one of the things that will come out of this is that there's more awareness that there are options, and for both low and middle income people. That would be a real positive outcome of COVID, that we said, oh, so while some of the nursing homes, the traditional nursing homes have suffered, where the people have suffered there are all these other places that people have been in for our seniors who everything was fine and was really positive. And what are those options? And so maybe that will be something that we all can work on to say, oh, it doesn't have to be, it's not just, nursing home versus living and with the kids.
Mm-hmm. Catherine McCallum says, I have a family member who is an admin in the state where they already do so much telehealth because of the rural population. The relaxed Medicare rules for our area, should they continue, will mean more aging in place and comfort in having appointments online. And, the telehealth is a benefit not just to the homebound, which is absolutely amazing. It's keeping us out of emergency rooms. It's keeping us out of, I shouldn't say emergency room, as we had heard from Dr. Mosini, who just opened an urgent care telehealth practice. It's keeping us out of places where people really need one-on-one, face-to-face, I got to bandage you up care. And that's great for infection, me infecting somebody or me being infected, but it's also great for the elders who need support.
I have a question for you, Steve, or anybody. I'm not familiar with this, but in other fields, for example, certainly Medicare has their online support, or rather the telehealth kinds of things. Student financial aid has the call-in center for these questions, all these places. Do you think that this is an area that there will be these large call centers where these people have basic scripts to follow, like, when people so somebody asks a question because, oh, I have this rash on my arm, and they go through this thing. Will there be more of that? Will they have call centers? Will that be a whole business?
Yeah, that's what we need, is more call centers, right? Man, they drive me crazy. But with specialists, with resources, I think you're right. And I think like area agencies on aging, which traditionally have been been sort of the closest thing to a call center that our field has, you can see where that could be a great starting point. Let's see, Catherine McCallum says, Medicare, which relaxed the rules for in-person session, is not giving us an answer when telemedicine, mental health, including phone calls. Has anyone heard? Yeah, if you guys know anything like that, throw it into chat or raise your hand and share some info. Let's see. Kathy Corden says, Steve, hoping you will post the recording with us, had to jump off. Yes, we'll post the recording, absolutely, as well as the chat. Lynn Reed, I hope senior centers and adult daycare centers are seen more critical than ever as a way to help keep people independent and engaged in the community with the families for as long as possible. I hope smaller long-term care communities and models such as Eden Alternative become a result of COVID-19. Lynn, I hope you're still on. I agree with you. And as a special treat, in a couple of weeks, we are going to be doing, at this session on Friday, we are going to be doing a live tour of a small house model at Goodwin House, and addressing the fact that anecdotally, the COVID-19 infections seem to be less abundant in the small house and the smaller senior living models. And for those of you who are like, holy cow, well, I work in an 80-bed community, the small house model is oftentimes like the neighborhood model, where you are basically creating small neighborhoods, and it makes a lot of sense that would enable us to be safer as far as infection control. Let's see. Brian Miller, a bit of a self-serving comment, but facilities and caregivers will have to participate in implementing and educating their residents in the use of technology. Absolutely. And, you know, Brian, as we kind of discussed on a call this week, we're also, and Bart, this is, you know, we've got all these dreams and we've got all these things that that in an idealistic world make a lot of sense, but then we've got providers that aren't ringing the cash register like they used to. They're buying PPE, they're hiring more people, they're, you know, they don't have the flow of residents, and they're budget challenged. It's like, it's a challenging thing.
But again, that's short term. We understand that.
Yeah.
I think that it's going to be interesting. I just thought one of the best jobs, one of the new jobs is going to be the IT manager at every long-term care facility, who's going to be responsible for IT for all of the residents, not the system, not the administrative system, but for the resident system.
Well, I have to tell you,
there'll be Wi-Fi in every room.
No, and you know, what's an interesting parallel is that that has been long overdue, and I know there are some communities, and actually, if your community has a system where you're providing IT support to all of your residents, let's bring you on at a future discussion, because that is one of the things. Like 10 years ago when I lived temporarily in these communities, the residents are pretty much on their own, you know, and many of us who are on this call have often sort of said, just like you have an IT person in an office who goes desk to desk and makes sure that Windows is up to date and all that type of stuff, I think that is going to be a new position that'll probably be, whether it be a subcontractor or an employee, that will be in these communities.
They'll be going after different kinds of viruses, won't they?
Yeah. John McCandless says, with the high percentage of COVID-19 deaths among African Americans and people who live in poverty or in low-income communities, how do we move to more diverse and affordable housing and caring opportunities? And again, great thought-provoking question. And again, I think diversity, especially in light of everything that's going on nationally now related to diversity, is something that I would really like to keep the pedal on and address in these forums in the future. One just anecdotal thing that I always like to share is that years ago there was an adult daycare community that opened up, and due to the owner's ties to the Persian community, they opened up and they instantly had 50% of the capacity were Persian-speaking individuals. And then when anybody would come in and tour, they didn't necessarily feel comfortable in that environment. And this owner, tried a lot of different things, but once he tapped into the fact that I'm not looking for one new participant in the adult daycare community, I'm looking for a table of 6 people that have synergy and a connection. And he teamed up with a leader in the Hispanic Latino community in his neighborhood. She was able to bring in that table of 6 participants, and it created engagement all throughout the community. And so I think one of the challenges in building diversity in all of our communities and our programs is that when somebody walks in and tours and they don't see people that they're connecting with, it's sort of how do we create that scale, and it can be done on a small scale and brought out to a large scale. Anyways, okay, let's see. Lynn Reed says, we need a standard ratio of staff to residents to become part of regulations for LTC communities. It's crazy there's no standard ratio for LTC facilities as there is for daycare, childcare. Yeah, I mean, we've all walked into communities and settings on a weekend and you can't find anybody. But yeah, it's like we have.
So let me jump
you're
in
from
here,
the
Steve.
education. Yeah. Bart.
Let me jump in here because I think that's an interesting thing, and what we're seeing, one of the things that comes out of COVID is realizing how understaffed and what the issues are. And that was one of the early questions. Will there be more regulations? Will we have seen where do the long-term care facilities fail and what kinds of regulations need to be put in place? Well, of course, that has both sides. I mean, you get to be overregulated and sometimes that helps. You get higher ratios. But I think that's a good point that post-COVID, it opened up the door. You could no longer be invisible. You could no longer ignore the fact that there just were not enough staff.
Mm-hmm.
And our seniors, our parents were dying. Our spouses and parents were dying in these facilities, and nobody was there. There were not enough nurses in hospitals. So staffing for post-COVID could be, I think that might be somebody touched who I want to know who touched on that, because that's something I really like to explore further. Because I do think that could be a real, in this case, positive,
Yep.
Essentially from COVID, directly from COVID.
Yeah, and again, we've got to balance that with the affordability and provider operations. Let's see.
Different issue.
Kay Bransford says, is my family the only one that started having conversations about the benefits of my in-laws living with us, and that we are open to this option, especially after my own parents refused to have living with a kid ever be the option? I floated it before, and now my in-laws are actually thinking about it. Wow. Yeah, I mean, I think, and I saw it in my students' comments, that there may be a change of the tide that broadens a parent's viewpoint of, Am I aging in place? Am I moving? Or am I living with my children?
But Kay, thank you. Hi, Kay. It's nice to hear from you again. I think you brought up a really good point about the new kinds of conversations that are going to go on. We always used to, again, in the Boomer's Guide, that so long ago, one of the first chapters is all about having the talk. And I think you bring up a very good point that because we're seeing it, up close and personal, these conversations now have to happen between parent and child. And hopefully post-COVID, that is going to happen. I think that's something I think that's an important element to highlight, that could possibly be a big change. I wonder, again, the sustainability of that. So we'll feel it for the next couple of years, and you and I will talk to our parent. Well, you will talk to your in-laws, or the kids. My kids will talk to me, right?
Yep.
But and yes, it actually, maybe from our side, we can do both ways. I can say I want to initiate the conversation, and maybe that's something. But COVID could actually, that could be one of the sea changes, that there's more conversations and different conversations perhaps than we used to have.
Jennifer is adding to Lynn's comment that DC has staffing regulations for skilled nursing facilities, and DC requires RN, CNA hours per SNF resident. So thanks for sharing that, Jennifer. And Joan says, I wholeheartedly agree with the need for Wi-Fi in all senior communities. It would really help set up seniors for success. There is so much untapped potential. An IT and assistive tech person would be fantastic, and I agree, it's long overdue. So, whew, man, this is exhausting. What a great dialogue. And right now, guys, it's 1:15. Okay, for the next 15 minutes, I'm gonna kind of let's experiment with transitioning this to a networking style sort of close. And you don't have to network, try to be brief, but if you want to just jump over and I can promote you where we all see each other. And we did this on Tuesday and it works. And how we do this is, if you want to be promoted to be visible, just raise your hand and I will, yeah, Catherine did it there. And then I'll promote you to panelist and you can share your screen. And I'm going to stop sharing my screen here. And we will do our best to kind of continue a discussion. And where are we at here? Hold on, guys. Oh, come on. I got to get my, there we go. Okay. So I'm getting everybody over. Just so you guys know, we had 200 people on the call today, and we're down to 70 right now, which makes it safe to try to do something like this, because when we did it before, about half of the people wanted to be on the screen, and we will try to accommodate you guys here. So Karen, here, I'm going to unmute you. You had a lot of great comments today. Tell us who you are and if you'd like to share anything.
Sure, thank you. This is wonderful. It's one of the best calls I've been on ever, I think. Really, thank you, Steve. I'm a registered nurse, aging life care consultant, a member of ALCA, which is the Aging Life Care Association. We're a national association. We have 2,000 members. I'm in Western North Carolina, near Asheville. Was formerly,
wow.
Yeah, I was formerly in Pennsylvania, and we have an upcoming personal talk later in the month. But one thing my husband and I noted today, Bart was talking about how a lot of these things that may be in place now be short-lived when the COVID kind of situation moves on, let's say, in the paper today, the Wall Street Journal and our local paper, there's nothing about how many people are dying or ill from COVID. It's all about the riots, the violence. It's all like moving on. And I'm really wondering, I mean, really short term.
Yeah.
So I think
that
a
was
lot
my
of
point. Yeah, that was definitely my point. I mean, we're such, you know, what have you done for me lately? This is, you know, that's tomorrow, that's yesterday's news. Moving on.
so that's a bit scary.
Yeah,
That's all
great
I-
comment there. And thanks.
I want to hear others.
Thanks for participating, and we're glad to have a North Carolinian with us. Okay, let's see. Catherine McCallum, another very active person there in the chat. What's going on? Oh, here.
You hear me?
Yep.
Great. Thanks, Steve. Just a disclosure, I was out gardening and wasn't prepared to be visible. But here I am in all my glory, all my video glory. Yeah, I am just getting, I was with the Aging in Place Village, Chevy Chase at Home for 7 years, and I watched the movement grow and grow and grow for people's desire to attenuate their time at home. And this is going to make it even a greater desire, whether it's a reality with the caregiving that family have to take on and how much people can do on their own at home. This remains to be seen. I do echo you about the concern about the virus. There was some things in the post today, some guidance on how to minimize the virus if you are choosing to march. But it is kind of scary that we're dealing with these multi-layered traumas. But I think this conversation is a wonderful one. We have a shifting population, a shifting in so many ways, but definitely I think there's going to be growth in the aging in place segment. And I just wanted to say that. And I have a consultation business. I have a Medicare. I'm attaching myself with one of the visiting primary care groups to be the psychotherapist by referral. I'm a Medicare provider, but I also have a small 3 to 5 session model to help families adjust to what it looks like to aging in place. Everything from connecting them with the local resources on safely aging if there's a fire, to the more minutia about which resources are out there, get connected, stay healthy and safe at home. And, and starting from, do you want to die at home, and move it back, because there are resources all the way through that may or may not fit the model that you want. So yeah, I'm excited about being a part of that. Sorry why we have to have this conversation. It's very scary.
No.
Q and I, Catherine, it's Catherine, right?
Yeah.
I'd like to be in touch with you later. So can we, when Steve shares the email, let's connect afterwards.
Sure, I'd be happy to talk to you. Yeah.
Next week's fine. It's just that I want to continue this conversation.
Great. Thank you.
I've seen some situations where aging in place was the worst possibility. So if there's a place, an add-on where the senior can live semi-separate from the family, that seemed to work well. But for a single senior in a house, just putting an elevator in was a totally different situation.
Hey, Beverly, great comment, but the best part about you talking is watching your dog crawl up on the bed there behind you.
Thank you for noticing that, Steve. My dog is outside.
Yeah.
She's a cute little guy.
Yeah.
Look at
Yeah.
her.
Good comment, Beverly. And I think, nobody on these calls needs to be educated on this, is that the prescription needs to be customized to the individual. And I think where people get nervous and get defensive is when they're sort of sold the one size fits all prescription. And that's what I'm kind of charged up about, how our community has come together now in a very supportive way. And the general feeling that I've got is, as a provider community, we recognize that senior housing probably has the biggest challenge moving forward, but I'm feeling less of this sort of to make a move or not to make a move. I'm feeling like the provider community is very supportive of senior housing as an alternative, and how can we make that work if that's what the customer's preference is? So thank you,
And
Beverly.
can I make a comment on that too, Beverly? I think it's a great point, and I am, having watched it, I'm a big believer in helping people move according to safety and what's best for everyone. I do think that the aging in place modifications can actually reach up into the housing, can actually reach up into the assisted livings and the senior living communities and inform them. I mean, you all were just talking about it. How do you create smaller pockets within even a high rise? You can have different egresses, different ways to deal with infections. So the creativity of aging in place is not just about sitting in someone's single family home. It's about taking the concept of that and bringing it all the way up through the housing that exists.
Great, thank you. Let's get to Pamela Silberman here. Pamela, tell us.
Hi. So good to see everybody, and I really found the webinar today to be very exciting. So for those of you who are familiar a little bit with me, so I wrote the well-being model that's used by Ingleside as their retirement communities. I'm actually no longer with Ingleside. I'm doing some consulting on the side and looking for my next adventure as to where that's going to lead me. I'm writing curriculum right now for a recreation therapy professional organization, kind of as a side gig in the meantime, but I'm always looking for leads to bring person-directed care into communities at large. I'm also looking more and more to home care. I really want to transform the world of home care. So if anyone has any connections with home care organizations that would be interested in bringing in consultants, particularly recreation therapists, to train their staff. I'm a certified Alzheimer's disease trainer, so I can certify all of your staff to be CDPs, which is a certified dementia practitioner, as well as do my own consulting and certifying in training. So if you have any leads there, that would always be helpful. But my passion is really to transform the lives of seniors overall. And I really feel that home care is the next way to go. So as a daughter right now who is caring for an elderly mom, who right now is in the hospital and experiencing that, I really know that world, both worlds, very personally and professionally. And there is so much out there that professionals that have that passion for providing extraordinary care can really bring to our community. And I look forward to collaborating with any organization that really has that same passion that I do.
Yeah, and Pamela, I'm going to reach out to you for a program that I'm doing on Tuesday.
Sure.
And it's a little bit of a twist on this, is that the marketing masterminds that we're going to do on Tuesday is going to talk about what are some things that we can do as a community. So like, wouldn't it be great if there were some things that we could do, and instead of one home care agency creating a manual, we did it for 40, and they all basically said, this is the standard practice that we all agree to. It helps pay your bill, but it also, it just, I'll chat with you on that, okay? And I know the next guy wants to connect with you too, is Mark Ash with a home care provider. Mark?
Thanks. Hello, everybody. Mark Ash with Right at Home. We are a licensed home care agency. We do the non-medical home care. So thank you, Pamela, for that. And I think, I've attended a lot of these sessions, and Bart and Steve, thank you so much for putting this together and your engaging conversation. And Bart, I'd be happy also to connect with you afterward to answer any questions or be involved in any interview that you want to. I've been in the senior care industry for more than 20 years. I've worked in adult daycare, skilled nursing, and I've been with Right at Home for 8 years. And we do design care plans to meet a person at their level of need. But overall, I think that as a group, we need to reach out to our communities earlier and educate people on their choices for what it means to age in place, and educate people on the options. Many people don't know about adult daycare. Many people don't know about home care and how that can help a person stay safe and thrive. So I would never say that assisted living or a larger community is out of the question for someone. Everybody has to make that decision. But people are at different stages of understanding and different stages of where they are in their lives, of planning and so on. So I think that we need to educate more and make people more aware of their choices, and also within a group like this, make people more aware of how we can work together to keep that person thriving wherever they choose to live.
Good points.
Thank you
Good
all.
points, Mark. And let me just, we've only got 4 minutes left till 1:30. So let me just get to Jennifer, Kay, Gina, and Ardell. Just real quick intros, guys, and then we'll wrap this up and hopefully we can keep things going. Jennifer?
Hi, I'm Jennifer Brown. I'm Community Relations Manager for Seabury Resources for Aging. It's a 96-year-old private not-for-profit, and we have a whole spectrum of services for older adults throughout the DMV. My primary responsibilities are in regards to care management and life enrichment programs, which are throughout the DMV. We have affordable housing. We do a number of other things. I get the time limit, Steve. And I did have a couple of comments about the villages and Gen Silent, but I have to say this, and I respect the comments. The fact that the Black Lives Movement has pushed the coronavirus off the front page of CNN is not the point. We can hold two concepts in our head at the same time. We should not minimize what's going on in the streets because coronavirus isn't the top headline on CNN. Thank you.
Good. Well said. Okay. Kay, another great contributor today. Thank you.
Thanks. Good to see you, Bart. It's been a while. And I like seeing your meal out, your first meal out after the restrictions have lifted. But I'm a daily money manager, a fiduciary for a lot of clients, and even a trustee. And I'm amazed, and thank you for the community that you have, Steve, because you've seen my posts on pro-aging asking people for help with clients that are driving that shouldn't be. But I see so many of the issues coming up and bubbling up. I have guardian cases going on. We have gotten 5 new clients in 1 week because people are failing in their homes living by themselves. So we need to do this better. We need to figure out a better way. So I'm just glad to be part of this community and looking for solutions.
Awesome. Thanks, Kay. Okay, let's get to Gina. Gina or Ardell, I'm asking. Okay.
So,
yeah. Hey, Gina.
Hi, I'm Gina. I work with the City of Laurel Parks and Recreation. And so my challenge during this pandemic is getting seniors to still be active while at home and not just sitting at home, and keeping them engaged in recreational activities while they're at home. So there was a lot of conversations and a lot of things posting, but it was about that didn't really lead to my situation, but were good topics and things of interest to me further down the line. So thank you guys for participating.
Thank you. And last but not least, Ardell.
I just want to say thank you. This was great. Thank you very much.
Now, where are you from? Where are you right now, Ardell? What state?
I'm in Birmingham, Alabama, at a big community, 350 people. I do professional. My current professional iteration is turnaround work. So I help with repairing census, and I'm in a gig I was supposed to be in for 4 months, and now I've been here for 1.5 years. So I'm very blessed and very grateful.
Well, I'm glad we got Alabama and North Carolina represented
You know,
on the call
I
today.
spent all my summers on Lookout Mountain. I love Birmingham.
It's a great place. Yay.
Great. Guys,
Great.
this was really a great discussion, and I think we're tapping into kind of a format, you know, where we just throw out a bunch of questions and kind of see where it goes. And Bart, I really thank you for writing that article, because you sort of were the catalyst here. I know we've only got a handful of people on the call still, but we'll send the recording out to everybody, and we'll keep the dialogue going. And Bart, don't worry, I'll share your contact
Great.
info, and I can give you anybody's name and contact who was on the call as well.
Terrific. Thanks, Steve. It was a pleasure to be here and talk to everybody. Thank you.
Thanks, guys. Bye-bye.